And when Carol described the last 24 hours, the pattern became clear. It was not one bad night. It was a warning window. They took him to the hospital. And not long after arriving, his heart rhythm became dangerously unstable. This time, he was already surrounded by people who knew what to do. That mattered, because if it had happened at home, in the hallway, in the bathroom, or behind the wheel, the story could have ended differently. Now, I want you to notice something. Richard did not ignore a dramatic collapse. He ignored the smaller warnings before the collapse. He explained them. He minimized them. He waited, and he almost waited too long. This is why the title of this video matters. What people did 24 hours before sudden cardiac arrest is often very ordinary. They watched television. They slept badly. They blamed coffee. They carried trash bins. They ate dinner. They told their spouse not to worry. But underneath those ordinary moments, the heart may have been sending signals. And after 60, those signals deserve respect. Now, in the next part, we'll talk about the first major warning pattern: unusual chest pressure, breathlessness, or heavy fatigue. 24 hours before sudden cardiac arrest, many people are still doing normal things: making coffee, taking out the trash, watching television, driving to the store, answering phone calls, telling their spouse, "I'm just tired," sweating. And that is what makes this so frightening. Sudden cardiac arrest can look like it comes out of nowhere. And sometimes, it does. But in some people, the body sends warning signs before the collapse. A strange pressure in the chest, shortness of breath that does not match the activity, a fluttering or pounding heartbeat, unusual weakness, dizziness, a near fainting feeling, cold sweat, a sense that something is not right. And instead of calling for help, many people explain it away. They say, "It's just stress. I didn't sleep well. I had too much coffee. I'm getting older. I'll lie down and see if it passes." But here's what most people don't realize. The most dangerous thing people often did 24 hours before sudden cardiac arrest was not lifting something heavy, not eating the wrong meal, not walking too far, but waiting. They noticed something. They felt something. Their spouse saw something. And they waited. Now let me be clear. Not every dizzy spell means cardiac arrest. Not every skipped heartbeat is an emergency. Not every tired day means your heart is about to stop. But sudden cardiac arrest is serious because when it happens, the heart suddenly stops pumping blood effectively. A person may collapse, stop breathing normally, lose consciousness, and need immediate CPR and defibrillation. The American Heart Association says that if sudden cardiac arrest is suspected, call 911, begin CPR, and use an AED if one is available. www.heart.org. This video is not here to diagnose you. It is here to help you recognize warning patterns that deserve immediate attention. Because after 60, the question is not, "Am I sure this is serious?" The safer question is, "Could this be my heart?" Mayo Clinic says sudden cardiac arrest often occurs without warning, but symptoms can sometimes happen beforehand, including chest discomfort, shortness of breath, weakness, and a fast beating, fluttering, or pounding heartbeat. Mayo Clinic. So in this video, I'm going to show you what people often notice in the 24 hours before cardiac arrest, why they ignore it, how cardiac arrest is different from a heart attack, which warning signs should make you call 911, and what to do in the first 5 minutes if someone collapses. Because those first minutes can decide everything. And in a moment, I'll tell you about a man who called it just a bad night, until his wife noticed the one sign he kept trying to hide. Before we go deeper, we need to clear up one thing. A heart attack and sudden cardiac arrest are not exactly the same. They are connected. They can happen together. One can lead to the other. But they are not the same event. A heart attack is usually a blood flow problem. A blood vessel feeding the heart becomes blocked. Part of the heart muscle does not get enough oxygen. The person may have chest pressure, shortness of breath, sweating, nausea, jaw pain, arm pain, back discomfort, or unusual fatigue. The heart may still be beating, The person may still be awake. They may still be talking. They may even try to convince everyone they are fine. Sudden cardiac arrest is different. It is usually an electrical emergency. The heart's rhythm becomes so abnormal that the heart can no longer pump blood effectively. The person may suddenly collapse. They may stop responding. They may not breathe normally. Or they may make strange gasping sounds that do not look like normal breathing. Within minutes, the brain and organs are in danger because blood is not moving the way it should. That is why sudden cardiac arrest is so urgent. Mayo Clinic explains that sudden cardiac arrest is the sudden loss of heart activity due to an irregular heart rhythm, causing breathing to stop and unconsciousness. Without immediate treatment, it can lead to sudden cardiac death. MayoClinic.org. Now here is where it gets confusing. A heart attack can trigger sudden cardiac arrest. If part of the heart muscle is damaged or starved for oxygen, the electrical system can become unstable. The rhythm can become chaotic, and a person who was awake and talking minutes earlier can collapse. That is why warning signs matter. Because the 24 hours before cardiac arrest may not look like cardiac arrest yet. It may look like chest pressure. It may look like breathlessness. It may look like palpitations. It may look like unusual weakness. It may look like a senior sitting quietly in the recliner saying, "I just don't feel right." And that is the moment families often miss. They are waiting for collapse, but the body may be warning before collapse. This goes against what many people believe. They think sudden cardiac arrest means no warning at all. And sometimes, yes, it can happen without warning. But some people do notice symptoms before the event. The problem is that the symptoms are easy to excuse. A fluttering heart gets blamed on coffee. Shortness of breath gets blamed on being out of shape. Chest pressure gets blamed on indigestion. Weakness gets blamed on poor sleep. Dizziness gets blamed on standing too fast. And a near fainting spell gets blamed on dehydration. Sometimes those explanations are correct, but sometimes they are not. And after 60, you cannot afford to guess when the symptoms involve the heart. Now let's make this simple. A heart attack is like a blocked road. Blood is trying to get to the heart muscle, but the road is blocked. Sudden cardiac arrest is like the power going out. The heart's electrical system fails, and the pump stops working correctly. Different problems, same danger. And sometimes the blocked road causes the power failure. That is why you treat warning signs seriously. The American Heart Association explains that cardiac arrest can occur after a heart attack or during recovery, and that heart attack symptoms can include chest discomfort, shortness of breath, and other warning signs, while cardiac arrest causes sudden collapse and loss of responsiveness. Heart.org. Now, if someone collapses and is not responding, that is not the time to figure out which one it is. Call 911, check breathing, start CPR if they are not breathing normally, use an AED if one is available. But if someone is still awake and having warning symptoms, that is the earlier window. That is the moment to act before the collapse, and this is why acting early matters. Because once cardiac arrest happens, every minute without CPR and defibrillation lowers the chance of survival. The first few minutes are not just important. They are everything. So the safest approach is this. If symptoms could be heart-related, call early. Do not wait for the person to fall. Do not wait for them to turn blue. Do not wait for them to stop talking. Do not wait for certainty. Certainty may come too late. Now, in the next part, I want to show you how this looks in real life. Not as a medical chart, not as a dramatic movie scene, but as an ordinary evening in an ordinary home, where a man kept saying he was fine, and his wife noticed he was not. I want to tell you about a man I'll call Richard. Richard was 72 years old, retired electrician, quiet hands, careful habits, the kind of man who checked the porch light before bed, locked the back door twice, and kept a flashlight in the drawer even though the power had not gone out in years. He had high blood pressure, a little extra weight around the middle, and a family history of heart problems. But he still thought of himself as strong. He mowed his own lawn, carried groceries from the car, fixed loose outlets for neighbors, and every morning he walked to the end of the block and back, not fast, not far, but steady. Then one Thursday evening, something felt different. He had finished dinner with his wife, Carol, chicken, green beans, a small baked potato, nothing unusual. Afterward, he sat in his recliner to watch the news, but halfway through the program, he pressed his palm against the center of his chest. Carol noticed. "You okay?" Richard said. "Just a little pressure." "Pressure where?" He tapped the center of his chest. "Right here. Probably gas." That word, probably, is where many dangerous stories begin. Carol asked if he wanted her to call the doctor. He shook his head. "No, I'm fine. I just need to sit." And after a while, the pressure faded. So he trusted the fading. Most people do. They think if a symptom goes away, the danger goes away with it. But here's what most people don't realize. Heart warning signs can come and go. A symptom may ease when the heart's demand drops. You sit down, you rest, you stop walking, you stop climbing, and the body quiets down. But the reason it happened may still be there. That night, Richard slept badly. He woke up twice, not from pain, from a strange fluttering in his chest, like his heart was skipping, then racing to catch up. He sat on the edge of the bed, listened to the house, told himself it was too much coffee, even though he had only had 1 cup that morning. By sunrise, he looked tired. Carol saw it at breakfast. His face was pale, his shirt collar looked damp. He pushed his eggs around the plate but did not eat much. She asked again, "Are you sure you're okay?" He said, "Just a bad night." That was his explanation. Just a bad night. And it sounded reasonable. Everyone has bad nights. Everyone gets tired. Everyone has a flutter now and then. But Richard's body was stacking clues. Chest pressure, poor sleep, fluttering heartbeat, pale face, light sweating, low appetite, unusual weakness. One clue could be explained. Together they were forming a pattern. Later that morning, Richard walked outside to bring in the trash bins, a job he had done every week for years. But halfway up the driveway, he stopped. He leaned one hand against the garage wall. Carol saw him from the kitchen window. He was breathing harder than usual, not gasping, not dramatic, just wrong. She opened the door and called, "Richard?" He waved her off. "I'm okay." But he did not look okay. He looked like a man trying not to scare his wife. That is another thing people do before emergencies. They hide symptoms to protect the family. But hiding does not protect anyone. It delays help. Richard came inside and sat down. This time, he did not argue when Carol brought the blood pressure cuff. His pressure was higher than usual. His pulse number kept jumping. One reading said 92, then 118, then 105. Carol did not know what that meant, but she knew it was not normal for him. She said, "We should call." Richard said, "Let's wait. If it happens again, we'll call." That sentence is dangerous, because sometimes again is not another warning. Sometimes again is the collapse. By afternoon, he felt a little better. That made him more confident. He told Carol, "See, it passed." But around dinner, the fluttering returned, this time with dizziness. He stood from the table and grabbed the chair. Carol saw his face change. The color drained. His eyes looked unfocused, and then he said the sentence that finally frightened her. "I feel like I might pass out." That was enough. Carol called 911. Richard tried to object. Of course he did. He said, "Don't make a fuss." Carol said, "This is not a fuss. This is your heart." When the paramedics arrived, Richard was awake, embarrassed, apologizing, telling them he probably just needed rest. But they took him seriously. They checked his rhythm, asked about chest pressure, breathlessness, palpitations, dizziness, fatigue, especially when it feels different from your normal. The first warning pattern is this: chest pressure, breathlessness, or heavy fatigue that feels unusual for you. Not always crushing pain, not always a dramatic collapse, not always the kind of scene people recognize immediately. Sometimes it is quieter, a pressure in the center of the chest, a tight feeling that comes and goes, a strange heaviness under the breastbone. breathing harder than normal while doing something ordinary, or a tiredness so heavy that your body feels like it is running on a weak battery. That is the kind of warning many people explain away. They say, "I just need rest. I ate too much. I'm out of shape. It's probably anxiety. It's probably my age." But here's what most people don't realize. When the heart is under stress, the warning may not feel like pain. It may feel like pressure. It may feel like air hunger. It may feel like weakness. And if the heart's rhythm becomes unstable, those symptoms can become more serious quickly. Mayo Clinic says sudden cardiac arrest can sometimes have warning symptoms beforehand, including chest discomfort, shortness of breath, weakness, and a fast beating, fluttering, or pounding heartbeat. Mayo Clinic. Now let's talk about chest pressure. Chest pressure is different from a sharp stab. People may describe it as fullness, squeezing, weight, tightness, a band around the chest, a heavy hand pressing from the inside. Sometimes it lasts a few minutes and fades. Sometimes it comes back. Sometimes it appears with activity and improves with rest. Sometimes it appears while sitting still. The American Heart Association says heart attack chest discomfort can last more than a few minutes, or go away and come back, and may feel like uncomfortable pressure, squeezing, fullness, or pain. It also lists shortness of breath and discomfort in the arm, back, neck, jaw, or stomach as warning signs. www.heart.org. Now, why talk about heart attack in a video about sudden cardiac arrest? Because a heart attack can trigger cardiac arrest. A blocked artery can irritate the heart's electrical system. The rhythm can become unstable. And then the emergency changes from pain and pressure to collapse. That is why you do not wait for collapse. The earlier warning may be chest pressure. Now let's talk about breathlessness. After 60, many people expect to get winded. They blame the stairs. They blame weight. They blame being less active. They blame the weather. And sometimes they are right. But the important question is not, do I ever get short of breath? The question is this different from my normal? If you usually walk to the mailbox without stopping, but today you have to pause halfway, that is different. If you usually climb the stairs slowly, but now you need to sit down after a few steps, that is different. If you are short of breath while sitting in a chair, now let's make a simple rule. If palpitations come with chest pressure, fainting, sweating, chest pressure, dizziness, shortness of breath, nausea, sweating, weakness, or feeling like you may collapse, call 911. If you faint, even briefly, and you do not know why, get medical attention. If your heartbeat feels rapid or irregular and does not settle, especially with other symptoms, get help. If you have a known heart condition and the rhythm feels different from usual, call your doctor urgently or emergency services depending on severity. Do not play detective at home. Do not search symptoms while sitting dizzy in the chair. Do not wait until morning if the symptoms are happening now. Most seniors miss this because they want a harmless explanation. Coffee, stress, bad sleep, heat, dehydration. And sometimes those are the real cause. But you cannot safely know that without evaluation when serious symptoms are present. This is not about fear. This is about respect. Respect for the heart. Respect for time. Respect for the fact that collapse can come fast. Now the next part is the belief-breaking section. Because what people did 24 hours before sudden cardiac arrest was not always something strange. Many did the most ordinary thing in the world. They waited. They sat down. They went to bed. They told themselves they would call tomorrow. And for some, tomorrow was too late. Your heart has carried you through decades of life, the joys, the challenges, the raising of families, and the building of your home. It deserves for you to listen to it when it speaks. If this deep dive helped you see these signals in a new light, please hit the like button. It tells the algorithm that this information is important, which helps it reach other seniors who might be experiencing these exact warning signs right now without knowing what they mean. And if you want to stay empowered and informed, subscribe to the channel. I'm here every week with practical, straightforward, and honest health insights designed to help you maintain your independence and vitality for years to come. Remember, you are the final authority on your own health. Trust your body, trust your gut, and never wait to take care of the most important muscle you own. Thank you for being here, for listening, and for taking this step toward a safer, stronger future. Take care of yourself today, and I'll see you in the next video.